most of the time, if we have neck pain and the arm pain, we usually treat with the medicines such as muscle relaxant, anti-inflammatory. We give a soft cervical neck collar, and sometimes the physiotherapy in the form of IFT, interferential therapy, or a traction therapy. I would say more than 80 to 90% patient, they settle down with the rest medicine and the physiotherapy. Now, patients who does not settle down with the conservative treatment with the medicines, in such patients, looking at the MRI, we go for a particular selective spine injection at the site of the nerve if it is getting irritated. So this is called as a selective nerve root block or a spine injection. So sometimes if the pain is not settling down, we consider this treatment option. In lots of patients, it gives a good relief, and usually after the pain relief, we advise patient to do regular neck exercises. Now, there are very few patients who does not get settled down with the medicines or a spine injection, and they may be having a severe nerve compression or a disc problem on the MRI. Now, such patients need surgical treatment. So what we mean by surgery? First of all, in the surgery, we do a cervical discectomy, where we have to remove the part of the disc which is pressing the nerve, and the damaged disc has been removed. Usually, instead of that disc, we have to put a spacer. Sometimes we put a plate and we fix that part so that again in the future the similar problem should not happen. So this is called as a cervical discectomy with nerve decompression. Now there are other way also, as we have heard of cervical disc replacement. So in such patients, usually a young patient with a only limited one level problem in the spine, and they do not have excess bone formation. So such patients, we can do a cervical disc replacement. In the cervical disc replacement, we have to remove the damaged disc, we have to free the nerve, we should remove and decompress the nerve, and then instead of putting a spacer or a plate, we put an artificial disc in that space. So let's say if we have a C5 or C6 level problem, we remove the disc and instead we put an artificial disc between the C5 and C6.